My name is Sidney Chahonyo. I am a cancer survivor. I'm a father of two. I'm married. They said I would never have kids, but I have kids. At the age of 19, I was diagnosed with cancer of the postnasal space. That's right behind your nose, where your ear, nose, and throat meet. I did my radiotherapy and chemotherapy here in Kenya. And in November, I celebrated 17 years of being cancer-free. Once you go through cancer, you start looking at life differently. You start looking at ways to give back. And what I did immediately after my treatment, I went to volunteer at the pediatric oncology ward at Kenyatta Hospital, Ward 1E. I would go there from 8 to 5 every day for about 5 months. And I just fell in love with the kids. Seeing kids going through something like cancer, and seeing the resilience they have and the fight that they have in them made me just fall in love with them. I kind of got addicted. Through that, I was introduced to Hope for Cancer Kids, and I am currently the board chair. What we do is we raise funds to support kids who cannot afford cancer treatment in Kenya. Cancer treatment is not free here and it's quite expensive. And a lot of these people come from very poor backgrounds and cannot afford treatment. So we work with social workers and the nurses in charge at different public hospitals to identify the cases that are the most needy. We then take on those cases and pay for the monthly National Hospital Insurance Fund premiums, and they can access treatment at any public hospitals. We are also involved in advocacy. We are represented on various technical working groups at the National Cancer Control Program, including the one for childhood cancer. We also have our art therapy sessions where we give the kids a chance to just be children and to smile and to forget for a minute what they're going through. We are also involved in awareness creation, whereby we try to sensitize both the public and also the medical fraternity, whether it be nurses, whether it be community workers, community health workers, or whether it be the doctors themselves, about childhood cancer, and basically so that people are more aware that cancer is real, childhood cancer is real. The youngest kid we have supported was 2 months old. We support them up to the age of 19. But if caught early, cancer is curable, and I'm living proof of that. I am a visionary, and I see HCK being a safe space for children who are going through cancer. I see HCK being a mouthpiece for those children and opening doors for the level of care and the level of holistic cancer care, especially in children, to be raised by the work that we are doing. Right now, our main program is our National Hospital Insurance Fund program. A lot of the time, you have people who travel more than 400-500 kilometers just to come to Nairobi for treatment, because I think in the public space, there are only 2 hospitals at the moment that have comprehensive cancer care. So people come from 300-400 kilometers away, they come to Nairobi for treatment, they're from very poor backgrounds. So a lot of the time, they don't know where they're going to get transport to come to Nairobi. When they're in Nairobi for example, a 30-day radiotherapy cycle, they don't know where they're going to stay or what they're going to eat. We have a lot of abandonment of treatment. Some people basically say, I have 5 other kids at home. I need to take care of them. I don't have money. My family has stopped picking up my calls. And they literally disappear until either the child dies or they come back when the child is at a very advanced stage. So one of the things I see in Hope for Cancer Kids' future is building an accommodation center close to the hospital, whereby when these people come to Nairobi, they don't have to think about finances, where they're going to eat, where they're going to sleep, so that they can just focus on making the child comfortable and on getting the child treatment. I also see Hope for Cancer Kids being very instrumental in the push to make childhood cancer free through NHIF, and also in creating awareness so that cancer is no longer seen as a death sentence, but it is seen as a disease like any other disease that can be treated. Just like HIV at the moment is easily treatable, treatment is accessible, and is very subsidized. So I'm hoping that Hope for Cancer Kids can be part of the push to do that for cancer. There are many ways you can get involved. You can directly send money to our pay bill, 511100. You can put your name or HCK for Hope for Cancer Kids, or whichever program you want to support, for example, NHIF. We also need a lot of volunteers. We are mainly volunteer-based, but we are transitioning from there to have more full-time staff. But we still need people out there who believe in our cause and can come and help us achieve our goals. We are looking for people from very different backgrounds. We need lawyers to help us. We need architects to help us with our design. We need people in the business community just to guide us on, how we are running the business. You can also get involved in our art therapy by just volunteering your time to come and join us every Thursday at Kenyatta National Hospital. And there are many other ways you can get involved. You can also just get in touch with us and we can give you more information about our programs. I've been at Hope for Cancer Kids for over 6 years. When I joined, Hope for Cancer Kids was supporting 16 kids per month. Last month, in August of 2022, we supported 206 kids. So that has really grown in terms of our capacity to provide access to treatment. Aside from that, there have been a lot of doors that have been opened over the years, and our vision for the future is different from where we were. We started at a good place, but it's now time to take the organization to a different level. Part of that involves rebranding, because what we did was we asked a couple of our board members and our partners what they thought of our logo, for example. And a lot of them said it's very old-fashioned, it's not creative, it looks like a government institution's logo. And from there, we decided to come up with a way to kind of revamp that so that we have a new, modern, dynamic logo, which will also allow us to take us through the next phase of the organization. So that is one of the reasons we're doing our rebranding. We're also working on our website at the moment. We are working on registering as an NGO, because currently we are a civil society, but we are in the process of transitioning to an NGO, a fully fledged NGO. And I think the logo is also just a symbol of where we have been and where we want to be in the future. September is Childhood Cancer Awareness Month, and that is one of the reasons there has been a lot of movement in the childhood cancer space this month. Not that we should only think about childhood cancer in September, but it is the month that worldwide a lot of people put their efforts together to raise awareness and to raise funds for children battling cancer. And that is why this month is very important for us. We've been very busy. We have an art auction. We also have other activities, both physical and virtual, webinars, fun days for the kids, just so that we can raise more awareness about childhood cancer and also raise money to support the kids that we support.